In an age of endless online information, many families are skipping well visits and checkups, thinking they're no longer necessary. But what are we missing when we skip those appointments? On the next episode of Ask the Doc, No Appointment, I'll address your concerns and explain to you why regular surveillance checkups are still essential. I'll address your most pressing questions and help you protect your family's long-term health. Don't miss the next episode.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, I'm Dr. Scarlet Constant, board-certified pediatrician and founder of Constant Care Pediatrics here in Miami. Today, we're going to talk about some of the reasons why it's very important to continue regular wellness visits with your children and routine surveillance visits. Please send in your questions and I will answer them in real time on this episode of Ask the Doc, No Appointment Needed. It looks like we have a question coming in now. The first question is from Robin. Your opening comments hit home. I'm someone who's hesitant to take my kids to the doctor. I'd like to hear your thoughts on why it is so important. Well, Robin, I'm glad that you asked that question. There are many things that are involved in a routine visit. It's not just a doctor wanting you to come to the office so that we could see you. We really do want to establish a relationship with you and your child so that we can continue a continuity of care during the lifetime of your child. I would like to be able to establish a baseline so that in the future, if there are any deviations from the norm, we're able to address them. Let's take a look at some of the bullet points that we would outline in a regular routine visit. The first thing we always look at is growth monitoring. So during a routine visit, we'll always check the height, the weight, the BMI, blood pressure, and basically from birth through adolescence, we're going to monitor your child's growth. It's important to not only note the weight. Some people might think that we're just checking to see if a child's overweight or underweight, but no, it is also important to check to see if they're gaining weight proportionately to their rate of growth and their height, which is why we also look at the BMI. So we'll check the weight, we'll check the height. There's something called short stature. It could be congenital, it could be genetic. It could be from a nutritional deficiency, or it could be from something more serious like a chronic illness that maybe is not diagnosed yet. So we really do use the height and weight, not only as a surveillance, but also to rule out any type of underlying disease that we might not know is present. Another important part or component of the well child visit is developmental tracking. This is so incredibly important. And this starts honestly from newborn all the way up until late adolescence, adulthood. And what we're checking as physicians is if the development of your child is up to par with where they should be for their age. So these are milestones that we look at. And the milestones are not only cognitive development, but it's cognitive, it's behavioral, it's social, their motor skills, fine motor skills, growth motor skills. These are all things that we evaluate during a visit. And, I will say that you might not think that we are evaluating this during the visit because we're playing with the kids and we're talking and asking questions, but we are able to ask certain questions and play certain games and interact with your child in a way that would allow us to fully evaluate and discern whether or not they are meeting their milestones. So this is a very important part of the visit, and it's important to do this in person because there are things that we can see and observe in person that are not able to discern during a history, let's say, or if you were to call into the office and ask certain questions, we wouldn't really be able to ascertain whether or not your child is meeting certain milestones that we're expecting. There are also sensory screenings. So again, a lot of pediatrics is evaluation through play. So we are able to evaluate the sensory skills and or deficiencies, if any. Behavioral and emotional health is so incredibly important. Maybe not the first 2 years of life, it's very hard to evaluate at that point, but after 2 years, especially after 3 years of age, as a physician, we are there to evaluate your child's behavioral and emotional health and well-being. And, I, of course, As a physician, I always speak to the parents and ask questions, but it's most important for me to speak directly to my patient, which is the child, and ask how they're feeling. How is school going? We want to know, do you have friends at school? Are you happy at school? Would you rather be home? These are all things in an interview that we can deduce the overall emotional health of your child just by conversation. And so again, sometimes parents might think that we as physicians are just being chatty or social or not really cutting to the chase. But this is, again, part of an interview process in order to determine whether or not your child's behavioral health and emotional health are stable or healthy, or maybe there is something that they are really concerned about and they'd like to discuss with their physician. And so that leads me to the next point, which is establishing a trusted relationship. The only way for us to be open with one another, both ways, the parents, the child, and physician, is if we have a trusted relationship. And that can only happen if you're regularly going to your doctor. And if you are regularly going and you are able to share with each other, again, I am able to deduce certain things that are going on based on evaluation or conversation, or you're able to open up and speak to me about it because you do trust me or your physician, whoever that may be. And so this is the reason why we need to have these established visits, to have continuity of care and trust between all of us, family and the physician. So we have another question coming in. This question is from Tracy. My sister's 5-week-old baby had a fever last week, and she rushed the baby to the local pediatric hospital. The fever wasn't super high, it was like 101, but she told me this was a medical emergency and she needed to get the baby medical attention right away. I don't have kids, but I thought she overreacted. Is a fever in a 5-week-old really a medical emergency? Well, yes, Tracy, a fever in a 5-week-old, or actually a fever in an infant under the age of 3 months, is a medical emergency. They might not necessarily have to go to the emergency room, depending on who their pediatrician is, they can go to their pediatrician's office, but we do advise not to medicate at home if your child has a fever and they are under 3 months of age, but instead to bring them to a physician right away, or the emergency room if the physician is not accessible, to be evaluated. And the reason is we need to know why this infant has a fever at such a young age. And there are higher risks involved under the age of 3 months as opposed to older children. So this means there are risks for bacterial infection, sepsis, pneumonia. Of course, viral infections are also a possibility, but we really can't assume that until a full workup is completed on this child. And the workup would include blood work, a check for a urine check, and of course, the typical viral antigen tests. And if indicated, and if there's respiratory distress, a chest x-ray would even be determined. But again, the severity or the intensity of the workup depends on the presentation of the child, and that is why the infant would need to be seen by a physician right away so they could determine how intense the workup needs to be. Okay, well, it looks like there is another question coming in, great, from Stephen. When we are out with other families, I see other kids being more interactive than my son. My wife says he's just shy, but I'm not sure. Should we be concerned? Stephen, that's a great question. And I'm glad that you're noticing this and that you are actually, paying attention to your child and the way he interacts. And of course, it's important to see how he interacts with other children and watch other children, and just to see if they are interacting at the same level. But again, I always remind patients, you don't want to compare your child to other children. Everybody's very different. Yes, he could be shy, or at the very extreme, he could have some type of social developmental disorder. I wouldn't know unless I saw him myself. So I would, of course, address that with your pediatrician and ask them if they see anything that seems to be a red flag or something a bit concerning. But I'm glad that you're on alert. But again, I wouldn't jump to that diagnosis right away. So it seems like everybody's really excited and has a lot of questions about this. Please, if you don't remember how to send in your questions, take a look at this video.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back. So looks like we have another question coming in. Let's take a look. This question is from Juan. I'm like a lot of my friends who question why we give kids so many vaccines. Are they all really necessary? Well, yes, one, they are definitely necessary. Why don't we take a look at this video and then I'll get to your question in just 1 minute.
I'm Dr. Whitney Caceres. I'm a pediatrician and a spokesperson for the American Academy of Pediatrics. Most importantly, I'm a mom. Number 1, parents are concerned about getting their baby multiple vaccines at one visit. This is based on a myth spread several years ago, which is still circulating, that babies' immune systems can be overwhelmed by getting more than one vaccine. This is completely false. The amount of active ingredients in each vaccine is a tiny amount. Your baby is exposed to much more in their regular environment every day. All the vaccines we recommend to be given together have been tested together, and babies do completely fine. Number 2, autism. This is a big one. This myth started way back in the 1990s when a paper was published by a doctor who looked at 12 kids and theorized that their autism was due to vaccines. That paper was discredited because it turned out to be based on bad science, and the journal retracted it. But it caused enough fear amongst parents that a lot of other scientists, good ones, studied the question, including multiple studies in different countries with thousands of children, and they found no link.
So Juan, to answer your question, the vaccines are absolutely necessary. And the reason that they're necessary is because they prevent against illnesses that young children are more susceptible to during that time. So what I'm saying is that in the initial visits, 2, 4, 6 months of age, 9 months of age, and 12 months of age, actually until 18 months of age, there are vaccines given at each of those visits. And these are small doses of the same vaccines because the goal is by 18 months, the child will achieve lifetime immunity. So what this means is 2, 4, 6, you get the dose 1, 2, and 3 of the same vaccines. Doses, and then you get another dose at 12 months, and 15 and 18, you also get booster doses. So by the end, the idea is your 18-month-old or even 2-year-old is fully immunized and protected before they go to daycare or preschool or anything else. The point is we want them to be protected before they are in face or in danger of getting these illnesses. And the window of time is the early years of life. And like the video said, these are small proteins that are being introduced. They've all been tested in children. They've all been given at the same time. So the idea is to try to capture these kids and get them immunized in a short span of time before the risk is way too big. The proteins are now in combination vaccines, so we give less pinches, less traumatic for the child. And again, we're decreasing the frequency of your visits to the office, which again is a whole other health risk. So I hope that this explains a little bit more. If you don't know how to send in your questions and you would like to continue sending questions, please go to the website and go to Ask Hanna, where there are nurses there to answer your questions if you're unable to get any of your questions answered today during this episode. Check out this video.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.
Welcome back. So please send in your questions. It looks like we have one coming in right now. Alvin, our little girl is 3 months old and is breastfeeding, but my wife always wonders about whether or not she's getting enough milk. How do we know if she's eating enough? Alvin, that's a great question. So your 3-month-old is breastfeeding, and I'm assuming at this point, breastfeeding is going well and mom feels comfortable. The way that you know she's getting enough is that she's gaining weight adequately at the right pace, and she's voiding and stooling as she should, as recommended by your pediatrician. This is another example of why it is so important to go to your routine surveillance visits. At 3 months of age, we would typically weigh and measure your infant and make sure that she's plotted on the growth chart and is in gaining weight at the rate that she is supposed to. These are all important factors during your wellness visits to make sure that we see that your baby is feeding well and thriving. So I hope that this helps. The next question looks like it's coming in. This question is from, let's see, Sharon. My grandkids spend all day and night on the computer, and my son says he's okay with it. I'm worried it will disrupt their development. Am I off base with that? Sharon, that's a great question, and it's something that a lot of parents are facing right now with this new, you know, age of technology. All of our children have either a tablet or a phone or some type of device. And it's hard to say that they shouldn't be on it because nowadays a lot of schoolwork is on the device. Sometimes they're playing educational activities. We don't know if they're playing video games or if they're actually doing their homework. Things are getting very blurred. You know, the American Academy of Pediatrics used to always recommend no more than 2 hours of screen time a day. I have stopped recommending that because on a personal note, my children do almost all of their homework on their device. So we can't even use that guideline anymore. I think it's just important to be vigilant and to, you know, be aware of what your children are doing. Why are they on their device? If they're playing video games, then maybe you have a time limit on those video games. I think it's very important as parents for us to really be involved and establish boundaries with our children when it comes to screen time. And if they're gonna do homework on their devices, that's fine, but then for pleasure, they only get a certain amount of time that you feel comfortable with, so that they're not spending hours on end on their device. Now, does it disrupt their development? You know, on some level, yes, it does. It actually impedes their social development. We've seen that children now communicate mostly through their devices or chatting or, you know, through social media. And of course, that has an impact on their social development and how they interact with each other. I don't think that there's so much evidence to say that it actually causes a developmental delay, but it absolutely affects them in a negative way socially. I will also say that aside from development, it has a very negative impact on eyesight. We've been seeing an increase in myopia at a much early age nowadays due to the devices and the screen reading in dim lighting and the decrease in playing outside and direct sunlight. On these children, they have actually had an increased incidence of myopia at a much early age. So I would absolutely consult your optometrist regarding this and, you know, and be vigilant about decreasing screen time overall for these reasons. Okay, so well, there are a lot of questions coming in. This is great. Looks like we have another question. This is from Raven. My baby just started school this year, and she seems to always be sick. Is there anything I can do to prevent her from getting sick all the time? Raven, that's a great question. I don't know how old your baby is, but I will say the number one answer I would say off the bat is I hope that your baby is fully vaccinated, because this is exactly what we're trying to prevent. You know, some patients ask me about specific diseases that the vaccines prevent, and they pick and choose and they say, well, I don't think that my child is at risk for this disease, or my child's not at risk for polio. Well, do you know what? Getting vaccinated not only prevents against those specific diseases, but it gives your immune system an overall jumpstart. You have all of these antibodies floating around, protecting you in general from viruses and illnesses. So a fully vaccinated child is a child with a very strong immune system that's ready to fight whether it's the disease, the virus, or the bacteria that the vaccine actually was protecting against, or other circulating viruses. So I would say first and foremost, I hope that your baby is fully vaccinated. A baby that is well fed, a baby that is thriving and getting adequate amount of sleep has a strong and healthy immune system that will help protect them from the illnesses that they're going to encounter when they're in daycare. If you'd like to send in your questions, guys, and you forgot how, take a look at this video.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Okay, so it looks like we have another question coming in. This question is from Charisse. I'm due to give birth next month and I'm already panicking. How will I know if my baby's developing normally? When should my baby start smiling? When should my baby respond to sound? Thanks for your help. Well, Charisse, congratulations, first of all. You're almost there. There are many questions as a new parent that you must have, which is totally normal. And your pediatrician, hopefully you've picked a pediatrician already and you've interviewed them and established a relationship with them, and they will help guide you and they will help answer all of these questions. This is something that we go over in time throughout the development of your baby. I think right now what's most important is for you to make sure you have a healthy pregnancy, you're staying hydrated, you're trying to get as much sleep as you possibly can while pregnant. I'm sure it's very difficult right now. And that you're prepared for the delivery. And when your baby comes, of course you will have all of these questions, but if you have a pediatrician that you chose and that you trust, that pediatrician will help guide you, will tell you what milestones to look for. Each visit, we actually go over the milestones that should have been established and the milestones that they should achieve before the next visit, so that this is what you're looking for in the time in between your next visit with your pediatrician. There are also some really great pointers on the American Academy of Pediatrics website, which has a Bright Futures section, and it's amazing. It has all of the milestones that you should be looking for with your baby, and it gives you the bullet points of what you should be doing with your baby and how to help the developmental process. So I would say take a look there. And again, always consult your pediatrician, because that's what we're here for. We're not only here to evaluate your baby and check your baby, but we're here to guide you and inform you and keep you as abreast with information and guidelines as possible. Good luck, and I hope you have a safe delivery. Okay, another question is coming in. It looks like it's from Nancy. My 2-year-old has become a really picky eater, and I'm worried she's not getting enough all the nutrients that she needs. What should I do? That is such a difficult question, because 2 is just about that time where kids turn into picky eaters, somewhere between 18 months and 3 years of age. And I totally understand how frustrating that must be. So the first thing I would say is don't give up. Don't give up and don't give in. Sometimes they get picky because they realize that they can kind of control the eating situation at home. And if they refuse things and hold out, then they could demand the yummy stuff that you probably don't want to give them, like the chicken nuggets and French fries and pasta and things like that. So I would say that what you'd want to do is, first of all, always introduce the healthy foods that you feel are what you feel comfortable your child should have at home. You don't want to give junk food. You want to really try to introduce foods that are within your comfort zone, and you want to just give small portions. And if they don't want vegetables, you don't want to make food a battleground. You don't want to fight with them over what type of food they should eat and shouldn't eat, so that food is actually a negative topic, or the table is a battleground. So what you want to do is try to introduce things that they enjoy, and then maybe have them try something that they don't really like, but you're encouraging them just to try, so that they can start a new variety. I wouldn't worry so much about them being malnourished. That's very difficult in a modern day society. They won't be malnourished. You're always going to feed them. They just might not be eating the things that you find are as healthy as you like. So what you'd like to do, try to give them maybe a veggie here and then a food that they like, and mix it together. Of course, there's always the hidden vegetables that are helpful too. Most importantly, when you go to your pediatrician, talk to your pediatrician about this. Make sure that they're gaining weight adequately, that they're growing at a rate that is appropriate, so that you are reassured that they're not nutritionally deficient. I hope that this helps. And again, try to go over that with your pediatrician, and we can outline a good diet to introduce at home. So let's see, we have one more question from Lawrence. This is: my 6-month-old baby cries a lot. Is it better to let him cry it out? Or if not, What can I do to help soothe him? No, your 6-month baby should not cry all the time. I would not let them cry it out. I would really try to ascertain what is causing your 6-month-old baby to cry. Is he colicky? Is he not getting enough sleep? Is he not feeding enough? Or is there something more going on that you might not be able to address? So I would certainly look at those things, and then I would talk to your pediatrician about it, have them examine your son, and see if there's anything else that might be causing your baby to cry so often. You never want to let a baby cry it out unless you're absolutely sure that there is nothing else going on. And again, well, it looks, again, if you want to send in your questions or you didn't have any questions answered, go to our website. Thank you again. I'm Dr. Scarlet Constant from Constant Care Pediatrics, and I'll see you on the next episode.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.